So these are my 5 favorite exercises for fixing jaw pain. And when I say favorite, what I mean is that we're trying to set your foundation. So I need to give you movements that I know help the broadest range of people with jaw pain. And that's what these are. So I want you to just quickly think of it this way. We have joints, and on top of the joints, we have muscles. The muscles are what hold the joints together. So the protocol I'm going to show you right now is first releasing the muscles, priming them for success. If there's tension, if they're too tight, if they're too irritated, we're going to loosen them up. And once we have more flexibility, now there's less tension on the joints. And after that, we're going to start repositioning the joint with a movement that I think will be very helpful. Now, once we have the muscle looser and once we have the joint looser, then we have to build strength to hold things and make them move in the ways that we want. And last, we're going to address the nervous system. So without further ado, let's jump in, starting with the muscle primers. So the digastric muscle goes from this mastoid process underneath the jaw to the tip of the jaw in the front there. And it, along with the mylohyoid, creates the floor of the mouth. So when you open up, if you kind of look in there, I got to twist the skull a little. You can almost see the red muscle a little bit in there. And so when you drop in your finger in here, you come a little bit off center and you sink straight in. And what's going to happen is you're going to end up kind of in here following the muscle. And then the other hand, which I was showing, meets it. And then you kind of can drag together all through the mouth through here. So imagine this was on the inside just to see what it looks like. You would kind of drag back and forth like this. Okay? Or you can kind of knead like this in one area and then work your way up like that. You're going to feel tension kind of all through here, and it's going to be pretty localized. Just through there, you'll feel tension under the jaw, and really it's just right under the tongue and then along the edges there. If you feel anything that's uncomfortable or doesn't feel right, more like not sharp but a little bit more jarring, just kind of get off that and keep moving, and you can feel a lot of release with this. You're going to slide your thumb along the outside of the bottom row of teeth until you hit this bone with the tip of your thumb. And on the outside of that is the masseter muscle. And from there, you're going to start pushing outward to massage it. You can stroke up and down with your thumb. You can take the fingers on the outside to actually grab the muscle and knead it like this. And the thing to be careful for is that you don't find yourself out here. So this is not the muscle. It's all the way back here. And that's why I have you slide back until your thumb hits the tip of this bone, because that can be your guide. Now, as you're kneading it, if you ever lose track of where you are, you can simply come back and see if your tip of your finger is near this, because that means you're right near that meat of the muscle. Okay, so use it as a guide. You can pinch and slide down like this. You can pinch and slide up. You can push out for a hold. You're just really going to work that muscle. And you can do it with the mouth closed like this. Or open. Because as you can see, when your mouth's open, it has a stretch on it. So you might be able to get a little bit of a different stretch with the mouth open or closed. And what you should feel with this is just localized tension. And you should also know that this muscle is known to refer sensations to the teeth. So if you feel anything on the teeth while you're doing it, that could be why. It's also known to produce potentially ear symptoms also. So that's not a part of the release, but if you start hearing a little ringing or fullness or something while you're doing it, you could know it's just something being referred by this muscle. Give it a try. Okay, so we've addressed some of the muscles, and now we want to take those joints and put them into a better position. And we're going to do that starting with the neck, because we know the neck has a major impact on jaw dysfunction. So you're sitting very upright. You bring your head all the way back as far as you can, and then you push on your chin, which is your overpressure. And you want to make sure that your head is moving on your neck and that this isn't forcing you to move through your whole body. So everything from here down is fixed, and you tuck back as far as you can and push. Now you pick a spot on the wall in front of you where your gaze is fixed, so your head goes straight back. I want you to imagine your vertebrae. When you look down, what do? They tilt forward. When you look up, your vertebrae go back. But when we do a chin tuck, the bones in your neck just slide on top of each other. So you're trying to make like a double chin, just like that. If you have discomfort and compression here, you may be extending too much. So what you can do, for starters, is try to fix your form, but if that still doesn't fix it, you can tilt down about 10 degrees and then kind of go up and back like this, just like this. And then over time, you should be able to do it in a straight on position again. And the correct form for this is that not only is your head coming back, but you have to imagine a string on the top of your head. And so as you come back, there's a lift. As you come back, there's a lift. And you'll feel like your upper neck is going into a decompressed position, like it's lengthening. So you're coming straight back from like more of a compressed position to a lengthened position, just like this. In between reps, just come to neutral. Don't do this and this, this and this. So you're sitting upright, come back and push. If for some reason you have jaw pain with this, which even people with TMJ disorder and jaw pain, 99% of them won't have any pain. But if for some reason you did, instead of pushing on the chin, you can push above the upper lip like this. And that will help you a lot. But if it doesn't matter, either way, I would push on the chin because you have a better biomechanical advantage. So again, you're extended up through the spine. And then when you do the actual chin tuck motion, all the movement happens here. The head comes back, the vertebrae get stacked over each other. And this exercise is to fix alignment of the actual vertebrae to free up the nerves and joint space. It's not actually for the muscles. We're not trying to strengthen with this. We're trying to get you into a better position. And with this exercise, if you have any discomfort that starts radiating into the top of the shoulder, down the arm, even into the shoulder blades, and no matter what you do, it just won't go away or it's worsening, then I would pause with this exercise and we need to give you a different variation. So give that a try. Okay, so we've gotten the neck into a better position. We've released the muscles. Now I want to start acting on the jaw itself with this four-way isometric movement. So what you're going to do is you're going to open your mouth like this and close it, but you're going to allow a place resistance on the bottom of the chin as you move through, and it'll look like this. Just like that. And then after 10 reps of that, you do the same movement of opening and closing, but you place a resistance laterally. So I'm trying to push my jaw this way, but my jaw doesn't allow that to happen. So it fights it and stays in the middle. So you place this resistance and you go. And then after 10 reps, we do it the other way. Just like that. And then last, we put your fingers on top of the chin and like you're trying to pull straight down, but your jaw doesn't allow it to just open fast, so you have to control the movement. Just like that. And so we're working on mouth opening and closing, but we're strengthening and resisting the muscles that act on the jaw in all different directions. Now, another thing I like to always discuss is neuroplasticity, which is your body's ability to learn. That's what neuroplasticity is. It's making new connections. And a lot of the time when we start having pain or symptoms on, for example, one side of the body, our brain has learned to check into that. It can produce more pain over time because that connection is stronger. You have a super highway. So sometimes what I like to tell people is, let's see what happens if we think about the opposite side of the body, which does not hurt, and we start focusing on it. Or if you feel that both sides of your body hurt equally, pick a totally different body part, like your knee. And I want you to close your eyes for a minute and think about that side or that area that does not hurt, and think about it and think about it. Don't think about anything else, keep focusing on it. And what you'll start to notice is you start picking up new signals from that area. Oh, wow, that feels a little tingly, or there is pressure in that area, or a light breeze, or anything at all that you weren't thinking about before. And the longer that you do this, the more you start picking up other sensations. And the point I'm trying to send home to you is that a large majority of pain, or at least a portion of it, can just come from your nervous system thinking about it. You've been in pain for 3 months, 6 months, or longer. This can be half of the battle. And so now that you kind of understand that concept, I want you to do something where you're not going to focus on the pain. So I want you to pick an object, pick something bright and shiny. Sometimes I use this red mushroom right here in my mind, and I want you to focus on it for 1 minute. Close your eyes, think about the details, what it looks like, what it might feel like if you touched it. And the whole time you're thinking about this, you're not paying any attention to whatever your main pain is, okay? And if your pain starts coming in, trying to say hello to you, what I want you to do is acknowledge it without emotion. So you just kind of put it to the side and say, all right, I feel what's going on here. I'll deal with that later, but I'm doing something else right now in a non-emotional way. This is called neuroplastic strengthening, because part of our pain that goes on is our decision to let it in or to not let it in. To give into it and say, I'm going to think about that, versus, no, I'm not going to give that life. And so if you can understand, number one, that we pull in sensations based on what we think about, and number two, you do have control as to allowing it to manifest or not, you can start rewriting your neuroplasticity. So it's something I just wanted to tune you into. This is the 5th exercise I wanted to show you. And if you really practice this for a minute, maybe once or twice a day, you can see how much power you actually have over your pain. And there you have it. We've taken 2 exercises to prime the muscles for success. We've acted on the joints themselves. We've built stability and strength, and we've addressed your nervous system. So get started with those. And if you have any questions at all or need help, don't hesitate to reach out to me.